Case 13, 2016, a 49-year-old woman with sudden hemiplegia and aphasia during Transatlantic Fligh. Definition: aphasia is an impairment of language affecting the production of comprehension of speech and the ability to read or write. Aphasia is always due to injury to the brain, most commonly from the stroke, particularly in older individuals. But brain injury resulting in aphasia may also arise from the head trauma, from brain tumors, or from infections. Hemiplegia, total or partial paralysis of one side of the body that results from disease or injury to the motor centers of the brain.
Hi Byron, how are you?
I'm happy. Are you pretty? You look good.
What are you doing today?
We stayed with the water over here at the moment. Talking to the people over there. They're driving for them at the moment. They're staying with their mom at the water very soon. For him. Good luck. For him.
So we're all friends who have to
Please
do
stay
this.
right here. Save the rain right there. For him.
I think we just did it again.
At the moment, I'm not sure that I will.
Yeah, I'm doing it again.
I changed for me, changed it for me. Well, yeah. I can talk to them sometimes. Along with them, other people are very cool with them. I'm very happy with them. This girl was very good. And I love her. And my brother. And they love trees. And play out with their hands. You say we're my hands, I'm holding her hands for this other hands. I'll let you get on top of that hand. Something. I'm not talking anymore. I say it.
Thank you very much.
Thank you very much. I appreciate it. And I hope you are nice.
Thank you. Stay safe. Bye-bye.
Have a good day.
Pros and cons. There are no pros in this disease. Hemiplegia affects a person differently. The most obvious result is a varying degree of weakness, stiffness, spasticity, and lack of control in the affected side of the body, rather like the effects of a stroke. Aphasia can be so severe as to make communication with the patient almost impossible, or it can be mild. It may affect mainly as a single aspect can be a language use, such as the ability to retrieve the names or objects, or the ability to put words together into sentences, or the ability to read. More commonly, however, multiple aspects of the communication are impaired, while some channels remain accessible for a limited exchange of information.
What's hemiplegia? Hemiplegia is a lifelong condition which affects one side of the brain in a similar way to a stroke. It's caused by injury to the brain. It may happen during pregnancy, birth, or early childhood, but it can also be acquired later in life. How many people have hemiplegia? 1 in 1,000 children born in the UK. It's not uncommon. What are the effects of hemiplegia? The effects of hemiplegia can be physical and non-physical. It usually affects movement on one side of the body. Someone might say they have right or left hemiplegia, but you can't always tell someone has hemiplegia. It affects everyone differently. And it's not just about physical effects. Many people with hemiplegia have additional conditions and less obvious effects. Hemiplegia can affect the body, learning, emotion, and more. Charlie has epilepsy as well as hemiplegia. He goes to a mainstream school where he sometimes finds it difficult to understand what the teacher is saying. His hemiplegia makes it harder for him to process information and remember other things at the same time. What can help hemiplegia? Having hemiplegia can be difficult or frustrating at times, especially when others can't see its complex effects. But its effects can be lessened with the right therapy and support. Siobhan has special equipment that helps her in the classroom, and her splint helps her walk and keep balance. Does hemiplegia get worse? Hemiplegia is a lifelong condition. It doesn't get worse over time. With guidance and encouragement, most transition into adult work and independent living. After leaving school, Jamal wondered how he'd manage with his speech impairment and visual issues in the job. But his mentor, Francesca, an adult with hemiplegia, offered advice on finding the right work experience. With her support, Jamal made an action plan and feels more confident about moving into adult life. HemiHelp is a UK charity providing support and information to people with hemiplegia, their families, and the professionals who support them. For additional information
Issue apply in Ecuador. The Embassy of Ecuador in Argentina, within the framework of inclusion, political and public diplomacy, made a presentation of the country at the Foundation for the Person with Aphasia and Environment. Fundaphasia, aiming at patients affected in their mobility, total or language, or part 2 to a brain injury, who can receive external stimuli and subconsciously with questions that are encouraged to share the receipt of the information presented.
Primary progressive aphasia is a disease where language, word finding, naming, naming of objects, those are the first symptoms. Again, memory is retained, and people are able to function quite normally in other aspects of their daily life. They're just having a lot of difficulty with language. Our director, Dr. Marcel Mesulin, was the first person in 1982 to describe primary progressive aphasia. And that has now led a lot of researchers and clinicians to identify primary progressive aphasia, and that now it has different subtypes. And I don't want to go into all of those subtypes because it's very complicated and very difficult. And this is also an area that is quite new and very exciting in the research. There are a lot more attention is being paid to primary progressive aphasia, and it's the I don't know if you say a sister diagnosis, but it's been kind of part or put under this umbrella of frontotemporal dementia. And frontotemporal dementia is the diagnosis of where behavior, personality, and judgment are the first symptoms. And the reason I think primary progressive aphasia is put under frontotemporal dementia is that PPA is in the temporal lobe of the brain is where our language center is. And as PPA progresses, it often progresses to the frontal lobe of the brain, which regulates our executive function, our ability to organize our lives, our personality, our judgment, etc.
Application in medicine. Physical therapy is the standard treatment for spastic hemiplegia and is for other forms offered several paralysis. There are many methods of this therapy which is aimed at strengthening the muscles as preventing further muscle stiffness. Medication to relax spastic muscles is used in spastic hemiplegia. Medicines are also used to treat seizures and other complications in this form of CP. Surgery may be helpful in this case of limb deformities, but the best treatment for this type of problem is prevention. Braces or other orthopedic devices can support movement and help prevent deformed limbs.
Hello everyone, I'm Kendra.
And I'm Kelly.
And we are the Community Service Chairs for the UMD chapter of the National Student Speech Language Hearing Association, or NISLA.
On behalf of NISLA and the Department of Hearing and Speech Sciences,
with the help of UMD's Office of Diversity and Inclusion's Rise Above and SGA grants, we welcome you to Aphasia. Hope is a 4-letter word. The mission of the Aphasia event is to provide education and awareness to the campus community regarding the communication disorder, aphasia.
Aphasia is an acquired deficit in language abilities resulting from damage to the brain. It can affect all ages and causes difficulties in speaking and understanding.
Let's see how our campus understands aphasia.
What is aphasia?
Excuse me?
Aphasia? What is aphasia?
I don't know what aphasia is. Should I know what that is?
What is aphasia?
I am not sure.
Okay. What is aphasia?
I have no idea. I know what aphasia is.
No idea. No idea.
Okay, thank you guys.
What is aphasia?
Aphasia is I don't really know.
Conclusion. In more than 60% of patients with ischemic stroke, the cause of aphasia and hemiplegia is readily established, as is the most often is atherosclerosis or heart disease. However, in a young patient with no traditional vascular risk factor and a large clot burden, the research can be brought to include at minimum thrombophilia, arterial dissection, paradoxical embolism, and unusual arteriopathies.